So the goals for today, I'm going to do basically 5 things. The first, I'm going to discuss the difference between research and clinical treatment. I'm going to talk about your role in research, the consent process, and I'm going to provide you a list of resources on where you can learn more about participating in clinical trials, and then leave, like I said, a bunch of time for questions at the end. So I'm going to start by discussing the difference between research and clinical practice. And I really like this quote about informed consent, and we'll talk more about informed consent in a few minutes, but I first wanted to highlight that research and clinical practice are 2 very different things. And they really come down to the difference between what are the goals of research versus what are the goals of clinical treatment. So the goal of clinical treatment is to provide the best benefit to that individual patient. And we really prioritize what is good for that individual as opposed to maybe what might be good for the general public. In contrast, research is to provide generalizable benefits. And what I mean by that is that the goal of research is to develop findings, develop new diagnostic methods, or develop new treatments which would be good for the general population. As a result, an individual who is a participant in the study may or may not get direct benefit from being enrolled in the study. And so there's a couple of terminology points that I want to point out. The first is this one at the top called therapeutic misconception. And therapeutic misconception is a really fancy phrase for research participants who believe that they are going to get some kind of clinical benefit from enrolling in the study. And the other important thing to terminology that gets thrown around a lot is this idea of placebo versus an active arm. So a number of times when you enroll in a research study, you might read in the consent that you might be, 50% of the participants will be put in the placebo arm versus 50% will be in the active arm. And what they're referring to is the active arm is where they're going to receive the active drug. And then the placebo is where you're going to get some drug or something that looks like the drug, but actually is kind of either what's referred to as a sugar pill, but it's a treatment that has no effect on you at all. And the reason why researchers design trials where they compare an active arm to the placebo arm is so that they have a base to compare it to, so that we can say, here are individuals who are enrolling in the study who have the disease that we're looking at. We're going to provide 50% of them with the drug, and we're going to see what happens naturally for the 50% that aren't given the drug and they're given the placebo. The reason why the placebo is so important is because of this potential risk of the placebo effect, which is this idea of, I'm going to give you an aspirin and you're going to think you're getting benefits from it and you're going to feel better, even if the drug isn't doing what it's exactly supposed to do. And so we use the placebo arm as sort of a stabilizing arm to see what happens when we don't give individuals that treatment. And so these are terminologies that you're going to hear in a consent document where they'll say this is a double-blind placebo trial. What they're meaning by that is that neither you nor the researcher will know whether or not you've received active treatment or an active treatment trial or received the placebo. And the goal again is so that if nobody knows who's getting what, then we can look at the outcomes, say whether or not your disease has or has not improved, or whether your symptoms have or have not improved. We can understand that better because we have 2 groups to compare each other to. Does anybody have any questions about this terminology before I go on? Okay. So then why do people enroll in research? If it's so different from clinical treatment, why would somebody put themselves at potential risk and maybe not get the benefit that you might get if you were if you were getting clinical treatment? So one is, the big one that we hear most is that it's going to provide benefits for general public and for future generations. So sometimes when I talk to patients with Alzheimer's, dementia, or other diseases, they will say, I know I might not be able to benefit from this, but I'm hoping that my kids won't experience what I'm experiencing. There is the potential that you might get access to emerging treatments, but again, that really depends on the design of a potential study, as well as whether or not you get put in the treatment arm or the placebo arm. And you may not know you won't have the ability to usually articulate which arm you want to be in, or your loved one wants to be in. And additionally, you may not know which group you're in because they've blinded it. And a number of people want to enroll just because of being able to participate in the process. I think particularly in a disease like Alzheimer's, which we all recognize has such major implications for families, for patients, as well as for the society at large, that the participating in the process towards identifying better treatments for symptoms or better treatments for the disease in general is really appealing. It gives patients and families an option of something they can do during this really difficult time. And then the last one I put in parentheses because many studies offer some kind of incentive or reimbursement for your time that you're committing to the study. I put this in parentheses because this shouldn't be something that drives you towards research. In fact, there are research ethics rules that prevent an individual researcher or a research study from providing incentives which are so high that it would really overly encourage somebody to participate. But a lot of times those incentives or reimbursements are there, and it's meant to be a recognition of the time that you're committing to this study. And so I want to shift gears onto informed consent, but before I do, does anybody have any questions about research design and how research differs from treatment? Okay. So in the context of, oh, I saw a hand go up. Go ahead.
I was just going to ask, can you receive treatment while also being in a study, or no?
That's an excellent question. So it really depends on the study design and then the treatment that you're talking about. So in a minute, we'll talk a little bit about the process, but in part of the process, you will be evaluated as a candidate, and that will include what treatment you are currently receiving for any disease, including the one that's being researched, and it may or may not exclude you from being enrolled in the study. But we'll touch on that a little bit more in just a bit. So it may be that you're able to continue with whatever clinical treatment you're also receiving for other conditions, or in some rare circumstance, the condition that they're doing research on. But the research team would provide that very clearly to you as far as how this might affect your clinical goals of care outside of the research study. That's a great question. Okay. So once you've decided that you want to enroll in a research study, one of the key components will be to provide informed consent. So what do we mean when we're talking about informed consent? Informed consent is more than just a signature. It's actually a full process of providing individuals with the potential risks and benefits of enrolling in research, and allowing that individual to make the decision for themselves. In ethics, we refer to this within the context of respect for persons, that we would never want to force an individual to participate in research against their own will. And really this whole idea of respect for personhood stems from, or for persons, really stems from a really long history of research abuses in the US, stemming back really back into World War II and the Tuskegee trial, when a large number of African American men were studied for syphilis without realizing that they were being studied, and suffered some pretty significant harms. And that study went on for over 30 years. And the Tuskegee trial and the results from that actually led to what's known as the Belmont Report and then the Common Rule, which these are basic common sort of guidelines that every researcher has to follow when conducting research. And many of them stem back to this idea that we should be respecting persons, respecting research participants. And one of the primary ways we do that is to allow them to consent to participation in the study. There's also a number of other protections that are put into place around research in addition to the informed consent, but I really wanted to focus on informed consent today because that's one place where you will have an active role in participating in research. And again, like I said, this is a process for providing individuals the information they need and to ensure voluntary participation in the research. So if you signed a consent form that enrolled you into research without getting all of the information about risks, including, say, what treatments you can or cannot be on, or the burden of being involved, for example, how many visits you're going to need to make over the next year and what's involved in those visits to the research site, or the potential benefits. So what is the research trial you're being enrolled in? Is it a trial where you give over one sample and they're using it to determine better methods of diagnosing dementia or Alzheimer's disease? Or is it a treatment trial where you might be enrolled in the active arm of the treatment? So these are all the types of things that should be included in the informed consent process. And there's 3 components of informed consent that we look for to make it valid. The first is voluntariness. So we want to make sure that nobody is pressuring you to enroll. The other one is that you get all of the information that you need. And then the third, and the one that's most unique to this population of research in Alzheimer's and dementia, is comprehension, also referred to as capacity or competency. So questions arise, particularly if you're doing research in patients with dementia or who have other cognitive impairment. What do you do if the individual lacks capacity to make the decision for themselves as to whether or not to enroll? So what do I mean by capacity? Capacity is the ability to communicate, understand, and appreciate your the choice that you have in front of you. And so the ability to communicate is exactly what you think it's going to be, which is, can you actually articulate for the individual who is providing informed consent to you what your choice is? The ability to understand is, do you have enough cognitive skill sets to understand the potential risks and benefits? And then the ability to appreciate is, can you not just understand that there are risks and benefits and what those are, but how they're going to have a consequence for you? So going back to this idea of, can you continue with your current treatment? If somebody was unable to understand that one of the risks of the study was that you would have to forego treatment X for your heart disease, because it was a contraindication for the treatment that was being tried, and you weren't able to understand how that affected you long term, so that it might have effects for your cardiovascular health long term, we would say that an individual did not have capacity to make their own decision. And then the last factor that you'll hear people talk about is the ability to reason. And what we mean by the ability to reason is, can you logically think through this decision for yourself? Can you identify, say, the reason I want to participate in research is because I want to help other people, and then use that information to articulate and make a decision for yourself? So I'm going to go on to what happens if an individual doesn't have capacity, but does anybody have questions about capacity or informed consent generally?
I was just going to ask, if you are the guardian of someone, can you enroll them in that role with capacity? Or
yes,
no?
okay, so that moves on exactly onto our next slide.
Oh, okay.
So what happens when you have a patient or a research participant who lacks capacity, they can't make this decision for themselves, and they are the perfect candidate for a study? So what happens then is that the research team will look to what we refer to as the legally authorized representative. And we identify the legal authorized representative in a structure. So first we would look to a court-appointed guardian. So this is somebody that the court has deemed has the authority to make decisions for the potential research participant. And then if that individual, if there is no guardian, or we would then look to see whether or not the potential participant had a healthcare power of attorney. And the healthcare power of attorney is a document which designates who you would like to make your healthcare decisions if you're unable to yourself. And then we would look to that person to say, what would you want? Would you want to authorize enrolling in this individual in the study? If neither of those people are named, so if we don't have a court-appointed guardian and the potential participant does not have a healthcare power of attorney document, we then go to a default hierarchy. And so then we would look first to the spouse, if the spouse is still living and available to consent. If they are not, then we would look to the majority of adult children. And then if, in this case, usually you don't have parents at this point in one's life, but in some types of research, we would look to parents. Then the majority of adult siblings, and then other family members. And so we would go through this order to identify who would be the best person to provide authorization for enrolling the individual in research. So yes, to answer your question, a guardian can authorize enrollment in research, provided again that it's within the research protocol. And I'll say this a couple of times, but every research study is designed differently, and sometimes the IRB, which is the institutional review board that makes sure that the research study is being done ethically, may put in additional protections. Those protections in some situations could say that only the participant themselves can consent. That would be fairly rare. Usually we allow a legally authorized representative to consent on their own. Other questions?
I have a question. Just going by this
Okay.
hierarchy. So you would say that the guardian and the healthcare power of attorney have number one position over a spouse or the adult children?
That's correct.
Okay.
So if we have a guardian or a healthcare power of attorney, those are the two individuals, and one over the or the other. So first we would look to see if there's a guardian, because that's where the court has said this individual has legal decision-making authority over the participant, that they have that authority to enroll them in research or to make, I mean, a lot of times it's just generally to make their decisions. And then if that person does not exist in the sense that nobody's been appointed as a guardian, we would then look to the healthcare power of attorney before moving on to the hierarchy.
Thank you.
Other questions? We'll have plenty of time at the end. I'm only 15 minutes into this conversation, and I'm sure that many of you have just general questions about research, and I'd like to have time to answer those. But keep them coming. It's a great question. So what is the process? So if you decide at some point that you would like to enroll in a research study, the first thing is that you're going to identify a study. How do you go about doing that? Well, first of all, there are some websites that are available, and I will show those to you at the end of the presentation, where you can conduct a search for ongoing research studies in your area, which will tell you what type of individuals they are trying to recruit for a study. The other and perhaps more common mechanism that individuals use to identify a research study is that their physicians would actually help them identify a study given their medical circumstance, or potentially the physician might actually be involved in conducting a research study or know of an ongoing research study that would be a good option for the patient. And then the research team is going to go about determining your candidacy. So again, you would identify a research study, you would contact the research study coordinator, which usually that information is available through the either the website where you found the research study or through the institution itself. And that individual, the research coordinator, is going to ask you questions about your health status, your age, your gender, and other factors which are relevant to the research study to determine whether or not you might be a candidate. You would then potentially go in for what's known as a screening evaluation, where they might run a couple of tests or look at your medical record to see whether or not you fit into the research requirements. So for some patients, particularly in dementia, research studies would articulate that they wanted a MOCA or an MMSE, which are both cognitive impairment exams, to fall within a certain range. And the reason they're using that range is that they would maybe want somebody really early in the disease process or potentially later in the disease process. They might be looking at particular lab values, or they might be looking at the current treatments that you're receiving, either for the condition being researched or for another condition that you have in your medical record. And the reason they're doing that is that some drugs are going to be known to be what's called a contraindication to the clinical trial. There may be bad reactions between the drug that's being tried and the drug that you're on, or there might be some other reason why the research team has determined that they don't want you on that particular treatment if you're going to be a participant in the study. So once they determine that you're a good candidate, then they will go through the full informed consent that would include the potential benefits and the potential risks and enroll you in the study at that point after you've provided consent, and then you're going to be participating in the study. Again, this is a general description of the process. It may vary on the study and the types of studies. Studies range anything from providing a blood sample and then they use your blood sample to look at your labs and that's it, and that's the end of your involvement, all the way up to really extensive drug trials where you'll be coming in on a regular basis to monitor your disease progress and your reaction to the drug. And then of course you start participating in this trial after you consented. I'm going to pause again. Okay, so let's talk about what your role is in the study. So first, if you're the participant, let's talk about it from that perspective. So your first thing you should do is to discuss your enrollment with your physician. That's your treating physician, not necessarily the physician who's running the research trial. It can get complicated if your physician is the researcher and he or she is wearing two different hats. They're both being your physician and they're being the researcher. But you should really discuss how this enrolling in this study could affect your long-term health as well as your health in the short term. So how is this going to affect your ability to continue with the treatment that you're receiving? How might this affect the care that you might receive during the time of the enrollment? That kind of stuff. And then you're going to provide voluntary consent if you decide that the risks and benefits are something that you're willing to accept. And then I think one of the things that's really, really important is that you abide by research and enrollment requirements. Having been involved in the Cleveland Clinic and a part of the Center for Brain Health here in Cleveland, I've noticed that sometimes one of the challenges for researchers has been that a research participant has decided that even though they weren't supposed to take a drug that would rule them out from the study, they started that drug again. Or they didn't maintain the records at home that they were supposed to maintain. So for example, enrolling in a research trial may include researchers asking you to document how you're feeling on the day-to-day. So that would be something that you would be expected to abide by. Another very important aspect of participating as a participant is that you report any adverse events. And that's really, really important to the research team so that, one, they can protect you from potential harms that could be greater without reporting these events, and also for documentation of outcomes related to the research. And every study should provide you with information on who to contact if an adverse event, and what I mean by that is if you start to have some kind of symptom or related to the study. And then also you can withdraw from the study at any time. This is the voluntary piece that really, unlike clinical treatment where you can also stop at any time, but you're not expected to receive direct benefit while you're enrolled in a study. You may get benefit. It does give you sometimes access to research or to drugs and treatments that others aren't going to have access to for some time. But also this does not commit you to being in the study regardless of how it progresses. So you can withdraw. But again, that is going to have some negative impacts on the outcome of the research. I'm going to move on to the role as a caregiver. And again, please feel free to ask questions. So your role in research as a caregiver is a little bit more complicated. in part because there are two standards we use when we look to a caregiver to serve as what's referred to as the surrogate decision maker, or what I was referring to earlier, the legally authorized representative. One is that we ask that legally authorized representative to use what's called substituted judgment. The reason why we use family members so frequently to serve as the legally authorized representative is they really know the individual participants' values and wishes better than we do, because they've known them for a longer period of time. So we're going to be looking to you, the caregiver or the legally authorized representative, to share with us, is this something that the participant, if they could make this decision themselves, would agree to enroll in? Sometimes we hear things like, my dad really thought research in science was really important, and so I know he would want to be a part of this, even if he can't consent himself, right? It's this idea that you're reflecting the decision that the individual participant would make for themselves. The other standard that we use to help make decisions is the best interest standard. And what that is that, if we don't know the individual's values, we don't know their wishes, then we just look generally as is enrolling in the study within the individual's best interest. And as I said earlier, that can be a little complicated when you're enrolling somebody in research, because they may not receive clinical treatment during the trial, or the treatment that's being researched during the trial. So they may not get the same direct benefit that they would get from being in a clinical encounter, excuse me. So your job, your most important job as a caregiver or a legally authorized representative, is to consider these two standards. One, is this something that my loved one would want to do if they were able to make this decision for themselves? And two, is this in their best interest to participate in the study? So then the other piece of it is, depending on your loved one's ability and their cognitive ability at the time, we really would encourage you to, and the researcher should as well, seek the participant's assent. So even if they're not the ones signing the authorization form, we should, include them in the process up to their capabilities. Help them try to understand a little bit about what's going on, and ask them if they want to be involved in this. So that may be, trying to break it down into language that they understand, or it may be things like, explaining to a participant that this means that they're going to come in for more lab draws and what that means for them, and do they want to be involved in it. So then your next role would be, if all of that jives, if you feel like enrolling in this particular study is what the patient would want, or what it would be in their best interest, you're going to provide voluntary authorization to enroll the individual in the study. And then your job as a caregiver and legally authorized representative is that you are then responsible for helping to monitor for study compliance and helping them with their involvement in the study, and really most importantly, being the participant's advocate. Speaking up when you think that there's some potential adverse consequence because of the study. Are they starting to have some kind of reaction to the clinical trial that you didn't see before? And then it's your job to withdraw the participant if needed. One way that this can get really complicated is if we think back just from an ethical perspective, the idea of an incentive is that you may be the one that's responsible for receiving that incentive, and you want to be sure that you're not being swayed by some other secondary gain for yourself or for the research study when you're enrolling a participant as the legally authorized representative. Again, I'm gonna pause. Does anybody have any specific questions where they've either considered enrolling a loved one in research or been involved as a surrogate for research and had issues arise or things that you didn't quite understand or that were confusing or complicated? How many people in the room have considered a research trial either for themselves or for somebody else? Okay.
This question.
Oh, yeah.
For this one, or have we ever been in another?
Just in general, I had experience in research trials.
Yes.
You don't have to tell me details, because that would be a violation of privacy stuff. I was just curious as to experience in the room.
Yes.
So I'm going to talk about some resources, and then we really have a lot of time for questions and answers, just generally, of things that I either covered or did not cover. So the first one I'll point you to is our own, which is, this is the information that's available on the Brain Health website if you're interested in enrolling in research. This is information or a number that you should be able to call, or an email you can call if you just generally want to understand what types of studies are ongoing at the institution. And they can provide you with the number of studies and help you identify one that fits your needs. Again, you should always talk to your physician about the potential of enrolling in a study before you enroll. The other one is, there's a website titled NIH's, which is the National Institute of Health, which is the federal body that both oversees and funds a majority of research ongoing in the United States, clinical research that is. And they have a website, and I provided it there for you, which includes both a lot of information about enrolling in research trials generally. Clinicaltrials.gov is a really great one for searching out potential trials. And so you can go in and look to see what trials are ongoing at the time, whether they're currently enrolling or if they've closed recruitment, and what the basic requirements for those trials are. So again, like ideally, and for many of you in the Vegas area, you have an institution available to you that you could contact directly to see what might be an option. But if you were thinking more nationally, this would be a website that would give you a sense of ongoing trials. Similarly, the Alzheimer's Association, which does fund a lot of research, also provides an overview of enrolling in research, and could provide some information as regarding what types of potential trials are out there that you might be a good candidate for. So I've covered a lot of information in 30 minutes. I apologize for going so quickly, but I would really welcome any questions I might be able to answer for you about enrolling in research, or serving as a legally authorized representative.
Are there any general risks to participating in a research study?
Any general risks? One of the ones that comes up quite frequently, regardless of the methodology that's being used, is a risk of privacy or confidentiality being lost. So anytime you're being researched, a number of people may have access to your information, and that's really controlled in a lot of ways. In fact, that's one of the stricter requirements that most IRBs put in place, is how are you going to protect the information of individuals who are enrolling. So, for example, regardless of the type of study that's being done, once you've provided them your labs or results, or they've run the test on you, you're usually assigned a de-identifying code, which what the goal of that is, so that you're no longer Jane Addams, you're 12F6793. And they automatically delete any identifiable information from that code that they don't need for their research trial. But however, in most studies, you will read that risk of privacy and confidentiality, or loss of privacy and confidentiality, are at play because there is information being used to conduct the study. I would say that that's probably the most global risk that's out there. Besides that, then it becomes really specific about the type of research that's being done. So for example, I know that we have a biorepository research study going on in the Center for Brain Health, and that study, what they're doing is collecting additional spinal fluid when they're doing lumbar punctures, and then they're basically storing that sample so that they can better understand the disease process, because spinal fluid has a lot of proteins and other information available through it that can give us a better sense of okay, so we know that this individual presented with these symptoms and this is what their spinal fluid looked like. So that biorepository is just a really simple one lumbar puncture, but there's going to be risks with the lumbar puncture. So the risks in that study are going to be different than being a participant in a study where you're trying a new drug and the drug itself may have additional risks. Did that answer your question?
Yes, absolutely. So curious question, do participants at the end of a research clinical trial ever find out if they were in the placebo group or the active group? Or does that always remain a mystery?
It depends, again, on the study. I apologize to sound so much like a lawyer today with all of the it depends, but it does depend on how the protocol is written. So some studies will say at the end of the study, we will disclose to you your individual results, meaning that they would probably tell you whether or not you were or were not in the active arm. So that's a good question to ask when you are going through the informed consent process. Will I find out if I'm in the active trial? A connected question to that is, if I find benefit from the trial drug, will I have access to it afterwards? In most cases, I will just say that the answer is no to both questions. And there are a lot of research methodology and FDA, the FDA is the federal agency that oversees drug development. And there's a lot of FDA regulations that really restrict being able to both provide information about whether an individual was or was not on the placebo or active arm, as well as providing access to the treatment afterwards. But in some circumstances, yes. And then also in some circumstances, you may be able to gain better access to information about yourself that you hadn't. And so some studies will disclose, for example, you can request or have the option of learning your genetic risk factor, a very specific genetic risk factor. Again, that is study specific. There's a few studies that do disclose genetic status, but it can be an option available in some studies. And for some people, that's why they enroll in studies, is so that they can learn that information. But again, very limited. These are really great questions. I'm happy to continue to answer more.
So generally in these studies, people already have these, I don't know what you would call them, diseases, illnesses, or can you be in it,
yeah.
if not, maybe it's a family member.
Yeah, so particularly in Alzheimer's right now, a lot of people that are being enrolled in research or recruited are either known to be at increased risk for developing Alzheimer's or dementia, or have demonstrated some type of impairment that would indicate they're in the disease process. However, sometimes you also see studies enrolling what are known as healthy controls. And healthy controls are used as a way to compare the group with the illness to a group without the illness. A lot of times those are diagnostic type research where they're comparing, do healthy controls have, say, lab results that indicate X just like those that present with the disease, or is there some difference? So again, this is where maybe the biorepository is a good example. I'm not positive, but I believe they're collecting healthy controls in a biorepository study as a way of comparing to those who are suffering from the illness.
Thank you.
So if you're looking for a study as somebody who is not at high risk or is not suffering from the illness themselves, you would want to look for studies that are recruiting for healthy controls.
Are children,
Did that help your?
Yes, ma'am. Thank you very much.
I was going to ask, are children a part of healthy control?
Our children,
Uh-huh,
our children part of the health, like our children of a patient.
yes,
So if you have like a mother or a father who has dementia,
Yes.
would that be considered a healthy control? For some studies, yes. It will
Okay.
depend on whether or not they're, in a lot of cases, I think, and again, this is science a little bit above my head, but in most situations, you would still be deemed a healthy control unless they're looking at something related to that has a hereditary risk. And so, for example, we do know that Alzheimer's, one of the biggest risk factors is whether or not you had a family member with Alzheimer's or dementia. So that may make you a non-candidate, but you wouldn't know that until you actually called a specific research coordinator and they could tell you how they're defining healthy control. And it may not be, research can be a lot of different things. It could be trying the drug. It could be, like I said, following lab values to see whether or not individuals who progress onto symptomatic Alzheimer's have similar or different results from somebody who doesn't progress to that range. Or they can be things like, I did a study 2 years ago where I did interviews with family members. And so I was recruiting family members to have conversations with them about their perspectives on emerging diagnostic technologies. And that's a really powerful way to be involved as a family member if you yourself want to enroll in research.
What is the duration length of most clinical trials, or is that just so varied?
It's really varied. So you've got everything from, come in, we'll draw your lab once, we'll draw blood or your spinal fluid once and then you're done, to we're going to follow you over several years. Because of the funding structure, I would say most studies aren't any longer than 5 years, but that would be that would just be sort of like a general statement. There are going to be studies that are going to follow you throughout the remainder of your life. Those are longitudinal studies. Those are a little bit more difficult to fund because of the length, but again, it really, really varies. And it depends on, prior to doing, let's take a drug trial, for example. Prior to that getting into testing in humans, there's a lot of behind the scenes lab science that goes on. And that lab science helps inform how long researchers expect that you would start to see some kind of impact of a particular drug trial. So that would be an example of, they determine that based on science of what they've learned up to that point. And then that's where they'll say, okay, we should do follow-up in 18 months, or, we're gonna follow people for 3 years. But it varies quite a lot. But it's one of the questions that if you were gonna have a list of questions to ask a research coordinator, that might be one of them.
and you gotta look at the expense too. If you don't have the research money or the family, would that be something to consider also?
I'm sorry, say that one more time.
Okay, I'm talking about the cost. You get in a
Yes.
trial, and all of a sudden you say it's 5 years, but it might need more research. And the way research funding is right now, how would the family pick up that cost? Because their insurance might not pick it up.
So for most research, if I'm understanding your question right, for most research studies, it should not cost you anything to enroll
Okay,
beyond what you're paying for your current clinical treatment. But if you're enrolling in a study where you're doing a drug trial, then there shouldn't be a cost to you. Generally, you're not going to be able to get access to that. Again, very generally, these are really broad sweeping statements, but you may not get access to the treatment that you enrolled in after it's been researched or at the conclusion of the study. That can and does vary. But it is a question to ask, particularly, say, for example, in a study that might disclose your genetic status, you may want to ask questions about what happens after that information is disclosed to you and whether or not your insurance company might pick up things like genetic counseling and those kinds of things that might come after the end of like the research boundaries. Other questions? Sorry, I can only see about like, I think a third of the room, and so I can't tell what's going on in the other parts of the room.
Is there any way to ensure that the results of the study are published, whether or not it's favorable to the sponsoring company? Because in the past and right now, if the results are not favorable to the sponsoring company, the results are just not published.
Right, so as a research participant, you could ask a researcher that question. Usually that is a decision that's made farther up the food chain when the agreement between, say, the industry contractor and the researcher agree to engage in this research, in this particular research. But as a research participant, it's a question you can ask, but there's no way for you to really alter or change that. But in most situations now, the trend has been, at least in ethics literature, that there shouldn't be any limitations on the researcher from publishing results, regardless of whether they're beneficial or not beneficial to the sponsor.
Well, a lot of times these studies are, most of the time, they're carried out in public institutions, that is a state university or something like that, which is publicly funded, and yet they don't publish the results if they're not favorable to the sponsoring company.
Again, I mean, I think, I fully understand the question. I would say that the trend is shifting, or at least the conversations in the scientific ethics realm are shifting from we should be publishing results regardless of whether or not they are positive or negative, because that's how we learn. But sometimes the other benefit, even if it's not published, is that we learn something from, okay, this drug didn't work. Why didn't this drug work? And they're able to use the information that they garnered from the study to then improve and try to fix whatever wasn't working in that situation to move research forward. And so sometimes, as a participant, it may feel like, oh gosh, I just participated in the study and nothing good came out of it. We didn't get a new drug trial, or we don't have the drug for Alzheimer's now. But really, research is such a step-by-step process that we have to have some of those failures in order to better understand how to do it better moving forward. And so, whether or not it is or is not published is an important kind of bigger picture policy question. But I think from an individual level, I think you're still contributing to science, even if the results aren't published.
I would want my results published if I participated in a study and
Yeah, I understand that, and it does vary from each study, depending on how the study is structured.
So if the results are not affirmative, and it's not published, do they at least share the information with each other institutionally so the same drug is, so like say the drug is eliminated or out of the picture? Do you understand what I'm saying?
Yeah, so I mean there's so many different layers to sort of the outcome of the research that happen. So what may happen is, for example, every year there's a large Alzheimer's Association scientific conference. And so the results from that study might be presented there and shared amongst a lot of researchers. Institutionally, that researcher is then going to say, okay, this didn't work, let me understand why, and I'm going to now change my research to move on, for my next research study, to improve upon this prior research study and better understand why that didn't work. A lot of times those things are, sometimes those are sorted out prior to getting tested in the clinical realm, but sometimes we just don't know how drugs are gonna work in individuals that have the disease. And so the lack of publication shouldn't be seen as a complete waste, or that the results aren't being included in the scientific process. It just may be a part of the scientific process. It's a really big policy question that you're asking, so very complicated in a lot of ways, and something that's really on the edge of conversations right now and how we think about scientific policy. So it's a really great area to explore. Other questions? We've got 12 minutes about individuals who are enrolling in research or are thinking about, not you guys individually, but does anybody have questions just about what it means to enroll in research or the process? Okay, well, Jasmine, if it's okay with you, I'll just say thank you. My email address is right there.
Thank you so much, Delane.
Oh,